Listen to your auntie, because they know some things.
I'm Dr. J. James Halbert, board-certified OBGYN, and I want you to know that a healthy you is the first step to a healthy pregnancy. Taking care of your mind and your body is the best way to give your baby its best start. We're out on location talking to women about pregnancy, the birthing experience, and postpartum care. And Michaela, so tell me, how pregnant are you?
I'm 8 months pregnant.
Are you okay with me touching your stomach? Okay, good. Why did you feel prenatal care was important for you?
I want my baby to be healthy, for me to be healthy, because I'm here first, and then here I'm putting the person into the world. I want them to be healthy as well.
Prenatal care is important. It is the time where you have set aside to talk to your doctors about whatever it is that concerns you as related to pregnancy. Make sure that your doctor is listening to you and hearing you. One of the old wise tale is that you cannot medicate pregnant women with medical conditions. That is absolutely, totally, unequivocally false. So, if you have a provider who's not treating your mental health condition, there's a couple of things you can do. One, either find an advocate for you in the form of a doula, in the form of a social worker, in the form of a family friend, somebody that goes to the doctor with you to help advocate to say you need medication and medication is available. Number two, you can always switch doctors because some doctors are better at treating mental health conditions than others. And did your doctor talk to you about resources at all for the mood disorder, the stress, or just kind of like dealing with the support group?
They will like always ask about it, but I would kind of say no because I would be scared. Like I wouldn't want them to take my child from me if I was like feeling sad or something.
Thank you for sharing that, because I think there are a lot more people in the community who deal with things in silence because of the fear, the consequences of admitting that you need help. When it comes to marijuana in pregnancy, just call it no.
I actually was smoking in the beginning of my pregnancy because I was having trouble eating and stuff like that, but I did stop during like my 3rd month.
Well, first of all, I want to congratulate you for quitting smoking. So that's a big thing. If you were going to advise young pregnant women about smoking marijuana in pregnancy, what would your message to them be?
My message would be to please don't use any marijuana, any drugs whatsoever, smoke cigarettes or drink any alcoholic beverages.
It can cause defects with the baby. It can restrict the fetus from growing, and it can cause miscarriages too.
And when we talk about the use of marijuana in pregnancy, one of the other pieces that we are seeing in the science is the low birth weight. And sometimes smaller babies just have a harder time growing in the beginnings. And low birth weight can have additional outcomes, but we associate low birth weight sometimes with increased sickness, a decrease in their immune system. That's another one of the effects of marijuana on the outcome of pregnancy. Your granddaughter was born early. What effect did that have on the family with the baby having to stay in the hospital longer?
We didn't really have transportation, so we relied on our insurance to get us back and forth to the hospital. The mom of the baby, she was just in a really sad and depressed mood because her baby wasn't home with her.
If marijuana was the cause, that when this happens, that it's not just the mom and the baby, but it's the actually entire family.
It is
that's
the
affected.
entire family because she needs a lot of love and support from the family, yes.
And so we've heard a number of different perspectives. And so when we talk about pregnancy, the birthing experience, and postpartum, we're not only talking about mom, dad, and baby. We're talking about grandparents. We're talking about aunties. We're talking about transportation and insurance companies. And all of those things help us make this a positive experience. For more information or to get support with your pregnancy or postpartum care, please contact us.